Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirley North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 to 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health. Well, welcome everybody. Thank you so much for joining us, newcomers to North Star Physical Therapy Podcast. And for those that are returning, we have a really exciting episode this time, pairing up with Lena Landis here from Landis Nutrition. And so we are going to kind of dive deep into what the heck, nutrition, functional medicine has that tie with pelvic health, lymphatic health things. And so we want to give a huge shout out to other allied healthcare providers. We're doing a bit of a series with some other episodes with, other kind of therapies or other kind of professionals. So today we're talking all about kind of nutrition. I don't like to say diet per se because it's a bit restrictive sounding, but nutrition and functional medicine and how important that really is. So Lena, take it away. Feel free to introduce yourself. How did you get into this stuff and tell us about your business?
Okay. Well, thank you so much for having me. I'm excited to be here. And that question is a tough one. I feel like I never know exactly. Do you want to sit here for a long time or short period of time? So my background is in nutrition. I studied nutrition and dietetics. I went to Syracuse University and played field hockey there. And I always felt like food was obviously very important when it comes to performance. And I think that that's why I chose that as my major. And then life happened and I got married and my husband's in the military and we moved all over the place, had kids. So I always kept my hand in nutrition in some way, some shape or form, whether it was, teaching exercise classes at the gym and counseling people, working at weight loss clinics. I did some corporate healthcare where we went out into the community. And I was a big advocate for healthy eating, good nutrition, movement. But it wasn't until my middle son was diagnosed with an autoimmune disease that was somewhat rare, just for someone his age to be diagnosed with it, that I decided, I want to go back to school. I want to see what I can learn, what research has changed, and how I can implement this in my home, specifically with my kids. So I went back to school. I studied human nutrition and functional medicine. So that's how I got my graduate degree. And then a little fun fact that a lot of people don't realize, but when you go down that path, you also have to do 1,000 supervised hours and sit for a national board exam in order to get the license, which is what I have. And it's called a certified nutrition specialist. So we could get into all of that, the difference between a CNS and an RD, a registered dietitian, but both of us, are really trying to support by providing medical nutrition therapy to our patients.
Wow, that's awesome. Yeah, and sometimes these little number letters behind a name, it's like the whole alphabet. We're like, what the hell does this really mean? So that's a good, it is a very distinction. That might be the part two, to this podcast for sure, of what the heck the difference is for that. But then the business that you started, so what's the name of that?
Landis Nutrition and Functional Medicine is the name of my business. And I wanted to blend the two. I wanted to blend that nutrition piece with the functional medicine piece. And that's exactly what I do. So I can basically see anyone. I would say kind of the trend of who walks into my office is typically a woman between the ages of 30 and 50, someone who maybe thinks it's perimenopause. What do I do?
Mm-hmm.
My hormones are changing. And I think the most special and rewarding part about my job is getting my patients that place to understand, like, we don't have to put a label on everything. So you might have
Mm-hmm.
a few of these symptoms that fall under that perimenopause umbrella. But when we start to look at, I'm going to say it, the diet, right?
Yeah,
How
right.
they're fueling their bodies. We learned that a lot of women are under fueling, and so we really
Mm-hmm.
work on meal timing and the composition of our meals. So anyway, I see a lot of perimenopause symptoms, GI symptoms. But then I have some outliers too that come in, and I just think truly that food is medicine and we can do so much with it.
100%, yeah, because we, as physical therapists, we think like exercise is medicine, so we're not trying to
Yes.
compete or anything, but we got to fuel our body in order to do like the mobility piece. So that's very much ties hand in hand. And if you were to try to help someone distinguish, like, like what is really functional medicine, right? Because sometimes we're like, oh, like functional, like fine and functional medicine provider versus like a PCP or a primary care provider, or like a specialist or whatever. So, like, can you help describe like what is the distinction? Like, what is really functional medicine versus like what they would get like at a primary, let's say.
Yeah, so I think like the number one response you would hear is functional medicine is getting to the root cause of the problem. And you would
Mm-hmm.
hope that any provider that you work with is
Mm-hmm.
truly trying to do that, but I think it's looking at the body in a with a more holistic perspective. And so that's a big piece of the work that I do. Of course, we're trying to figure out, if it was a GI issue, what is causing
Mm-hmm.
that GI issue, not just here, take some Tums. These should help,
Right.
right? It's not like we're putting a band aid on it. We're trying to figure out systemically what's going on, where are there gaps in the diet specifically. That's really what
Yeah.
I'm looking for. But how can then we improve those symptoms or eliminate them completely?
Mm-hmm. Mm-hmm.
So I think that that's probably the biggest difference as far as a functional medicine provider. But then I think what's kind of neat is what our backgrounds include, right? So you could
Mm-hmm.
have a chiropractor who's a functional medicine provider. You could have a dentist who's a functional medicine
Mm-hmm.
provider. And that all looks different. But I think the one underlying thing is that we're all trying to get to the bottom of why is this happening in the first place?
Mm-hmm.
And how do all the systems in the body complement each other? But then, like, from our specialty, how can we approach that with some other tools other than just your typical medication
Yeah.
prescription?
That's so nice that you like made that distinction, because I was realizing that too as I kind of do a big search of the land of like
Yeah.
providers to like network with, and people move offices and new providers come into town and all that kind of stuff. I realized there was that about functional medicine, that there was like an underlying, there was something else, that they have like a specialty in. So it's like same thing where I'm a physical therapist, but I have a specialty within pelvic health and lymphatic health. There can be functional medicine providers that also have specialties within other things. And so that was interesting, because I do see that a lot,
Mhm.
like you have like your nutrition background, and then but there's also like chiropractors that I know they're
Mhm.
also functional medicine providers. Like, oh, how does that work? So
Yeah.
that's interesting that you can kind of like layer that in. But I like getting down to like the root cause, or else like stuff's just gonna stay there.
Mhm.
And I call it like the contributing factors, right? Like, what are all these contributing factors to what's going on? Um, and we go with each factor. But sometimes, like, yeah, if I'm seeing somebody, let's say for like constipation, we're looking at the pelvic health side of things. So it's more than just at the pelvis, right? We have to incorporate the gut. That's the end of everything, right? So it's like,
Yeah.
but that starts from the mouth, like all the way down, doing all of the more like physical things, adding in, is there a nervous system component? Is there potentially behavioral health component? Is there a lifestyle thing? But as a physical therapist, like, I kind of know like basic stuff, y'all. But like when it comes to like specifics, but like you go above and beyond. So to be able to like pair up with you and like refer folks to you, and we all work together. So speak a little bit about like how do you kind of figure out, especially for like gut health or someone that has like those GI symptoms, like what are some tools or things that you utilize to, not necessarily like diagnostics, but a little bit, but like what does that look like for you?
Yeah, so I think that's a great point, and I think that um, all functional medicine providers probably have these tools in their toolbox that are considered functional tests. So that could be something like a stool test, that could be sex hormone testing, it could be just a more in-depth blood work panel than
Mhm.
maybe what your PCP would order. Um, Another one I've been doing a lot lately is a genetic test. So
Mhm.
there's mold testing. I mean, the list goes on and on. And I think that those are tools that we use to, we can't technically diagnose, or at least I can't being a CNS, but it's gathering that information and then kind of putting that into a pretty package for the patient to get a better understanding of, wow, this is truly personalized medicine. This
Mhm.
plan isn't a generic protocol that you just give to everybody. You know, this took all these different things into account when you
Mhm.
build out this protocol that are for me and my body specifically in this phase of life. So for GI testing, if my patients are open to it, I always love to start with a stool test. Now,
Mhm.
financially, not everyone can afford it. They might not feel comfortable collecting a stool sample, which I understand. I have three
Right.
boys, so for me, it's like, what, or if you have little kids and you're
Yeah.
changing diapers. But I think that that is a wonderful place to start because it's kind of like the center of your body. And so we
Mhm.
can gather so much information from that stool test as far as digestion goes, overgrowth of good or bad bacteria, H.
Mhm.
pylori, inflammatory markers. I mean, we just get so much information that we can't see with the naked eye.
Right.
So I would say I like to start there, and we don't always need a test. Like, I just think it often complements the care plan that I have set
Mhm.
up anyway. But for some people, it's kind of that proof of, okay, you've been asking me to do this, and I didn't totally buy in until I saw my results. I have that
Mhm.
happen sometimes. And then
Mhm.
once they have that proof, it's like that seals the deal, and
Right.
they're all in on the plan.
Right, right. It's like we can take as much of a subjective exam. It's like sometimes the
Yes.
subjective stuff and like that history that a client is telling us is kind of painting that picture to then almost like form a hypothesis in a way. Like, okay, and then what are my objectives finding actually find? Is that, was
Yes.
that really what's going on? But yeah, because people will ask me like to diagnose. I'm like, you don't need a diagnosis to see me. I'm going off of your symptoms and we're trying to find
Right.
the root cause of it. And we
Yep.
go from there. So your symptoms like get resolved. They don't come back. We build up resiliency in your body.
Yep.
But with like gut and nutrition, that's definitely probably diving deep into like some like lifestyle like
Yes.
modifications and stuff. So are is there like a um there's like a screening tool that you have to do, I'm sure, of like, do we need to have other providers like involved here to kind of help supplement what we're trying to change? I
Mhm.
have a um like a little question on my intake form, like, what's your willingness to change?
Yes.
Because it's helpful as the provider to know, like from the get go, are you willing to change or not? And that's
Mhm.
okay, whatever the heck that answer is. But then that way, we're not beating a dead horse and we're managing the expectations. So,
Right.
like, I'm sure for what you do, it's like people probably been eating the same way, what they have access to, and to like open up their eyes
Mhm.
to other things.
Yes.
Like,
Yeah, and to your point, sometimes I get referrals from doctors' offices of like,
mhm,
because I think a lot of providers realize that they're for like everybody could probably work on their nutrition. Like
right.
whether you think you have issues or not, or symptoms or not, right? Like even me, I could probably change a
Oh,
few things within my
100%. I worked out
next to
yesterday.
nothing.
We're like, we're getting crumble cookie tonight, guys.
Yeah.
I totally get it.
Right. But I also feel like creating balance is super important
Yeah.
as well. So I mean, I love when I can find providers that are willing to collaborate, whether it's a doctor's office or a pelvic floor physical therapist, or, I always tell my patients that's when you're going to get the absolute best care because we are all on the same page,
Yeah.
and you specialize in one thing, I specialize in another. But if we're working toward the same goal, like we're all
Mhm.
a team. We're going to achieve that a lot faster and more smoothly if we can all work together.
Right. And I think like I was just speaking to a client earlier, and it's like she's a little bit like later on in life, and she says, I feel like my whole life is around like all types of different allergists, right? Like
Yes.
all these different specialists. I'm like, but yeah, like your body doesn't work in silos. There's people that specialize in different things, and we all work together,
Yep.
and we're a part of their village, not them trying to fit into ours. So
Exactly.
it's like whenever I collaborate, like I like legit collaborate. I'm like emailing, I'm like, hey, I'm sending, like we're sending
Yes.
this person over to you or whatever. Or if there's something that was like a light bulb moment in our session, and it's like, hey, I just want to let you know X, Y, and Z. Or if you're adjusting like a little bit of diet and just kind of see how it is, I can give you feedback. Like, man, like Miss Smith said, like she's been pooping great ever
Yeah.
since,
Yeah.
um,
Yeah.
but stuff like that. That's what's so nice about having that kind of holistic care and having those practices. And so, paint us a little picture of like what does it look like for you. So if like somebody new, is like lands on your website, or I refer them,
Yeah.
to
Yeah.
you.
Yeah. Yeah.
What is that kind of initial like assessment or evaluation, or that initial call? Like, what does that kind of look like for you
Yeah.
typically?
So I always offer a free discovery call
Mm-hmm.
where if they do land on my website and they're looking at the packages that I have available, but they're not sure which one they want to choose, they can
Mm-hmm.
call me, email me. I always like to tell my patients, like, I'm always available if you need
Mm-hmm.
me. So if they decide, okay, let's do this, I want to sign up with you. I have a 3 month, a 6 month, and a 12-month package. They all basically start the same in the sense of, once you sign up, you will get the intake paperwork
Cool.
emailed directly to you. I have a pretty long intake form, but it is because we are looking holistically at the body. So
Mm-hmm.
I'm asking questions about their diet. I'm asking questions about lifestyle. How many
Mm-hmm.
hours are they sleeping per night? Are they well rested when they wake up? We were talking about the gut, and a lot of people don't realize that the circadian rhythm affects our bowel movements, and
Mm-hmm.
that's important, right? Like, I harp a lot on bowel movements, and for
Yeah.
some people, like, that's my main goal, just to get them to poop once a day. And it might sound
100%.
crazy, but you probably get it with
Oh
the
my
work that
gosh.
you do.
If I can get people to breathe and poop every day, like the world would
Yes.
be a better place.
Right? Isn't that the truth? Yeah. So I'm looking at those things, but I'm also looking at menstrual cycle. I'm looking at digestion. I might have said that already. I'm looking at movement, like, what do they like to do? I'm looking at support systems, medication lists, supplement lists that are sometimes a mile long, medical history, family history. So it's pretty
Yeah.
comprehensive.
Yeah.
And we take all of that into account as we build out our plan of next steps forward. So they'll receive that. I also have a questionnaire that's a My Symptom questionnaire. And for me, that gives me a good idea of what system do we need to focus on first based off
Mm-hmm.
of their symptoms. So the end goal is to decrease those numbers. Usually people have very high scores when we first start, and then very low scores by the time that we finish. But that's a nice tracking tool. And then, of course, I also send a food journal. So they'll fill out a 3-day food journal. And the last little piece, I like to send out a trauma questionnaire. So I did my thesis on adverse childhood events and how they impact obesity later on in life. And so if my patients are open to filling out that questionnaire, I think that that can be really valuable information. I mean, we spend a lot of time talking, and food shows up a lot with regard to different seasons of life, emotions, things like that. So I find that it's really a nice tracker tool as well if my patients are open to filling that
Mm-hmm.
out. And I gather all of that before our first session. And then for our first session, it's about 75 minutes for that intake. So again, just giving you the time to share what you have going on, making sure that you feel heard and understood. But I also have a couple devices in my office that I like to use. So I just got a brand new scale, and it'll be measuring body fat, visceral fat, hydration, all that good stuff. So lots of different markers. But I also have this other breathing device that's called a review breath test. And it's a 10-minute non-invasive breath test. You just hang out on a recliner in my office. You're hooked up to this long tube, and you can look at cookbooks that I have in my office or hang out on your phone, whatever it is that you want to do. But you come in at rest, fasted, and what that does is it gives us an idea of your resting metabolic rate, or how many calories your body is burning just at rest when you're sitting there. So while some people think like that could be a great tool for weight loss, it's also a great tool for pretty much anyone, because it gives us that starting point as far as what is your body's energy level needs, and then how do we work off of that.
Oh, I love that. It seems so very, very comprehensive. And sometimes I'm sure people might feel one way or the other with something like that. But I think we're starting to get into the age and the generation, quite
Yes,
frankly, that's like we need to know all these kind of answers. We're not trying to be like nosy or it's like, but you are a very complex creature, and we need to like make sure we're doing the right plan. And this
yes,
is just a generic thing, because two people are not the exact same.
exactly.
And so, yeah, I often like have to be like, yeah, I'm going to ask a lot of questions, you know, and like
Yes.
really pointed questions to help really guide what's going on and manage expectations. But also like, yeah, you don't know if someone may need to adjust like their sleep patterns, or gluten intake, or like how they're breathing. I mean, there's just so much stuff going on. But it's so nice that you really like take a step back and look at the whole, yeah, picture there with all of that. And then that's not even including like all the other tests, you know, you didn't get to, where like I'm sure that's just like a stepping stone.
Yes.
So if that kind of not triggers necessarily, but if that kind of flags something like, ooh, we might need to dive deep into this because that's what your symptoms are.
Yeah, and when we think about food too, specifically, it's so complex in the sense of, why do you reach for certain foods? Why do you eat at certain times of day? Why do you go for that bowl of ice cream after dinner? I mean, I had a patient once that was like, I know that I shouldn't be eating a bowl of ice cream after dinner every day, but it's what I've done since I was a little boy. Like it was
Yeah.
just, and I never really thought anything of it. And it's just a habit. Like I don't need it,
Yeah.
but I like it.
Right.
And, so it's things like that where just because we ask these questions, I mean, I try to make it like a safe space for people
Yeah.
to open up. And then if I don't have the tools to help them with their specific thing, I'm so quick to refer out to find other trusted, partnering providers just like yourself, again, so that we can deliver the best care possible.
Yeah. Well, that's awesome. And what kind of things on like your website? Like, do you even have like little resources and things like that
Yeah.
too?
Yep. So I have a blog that you can find on my
Oh,
website. I also have a newsletter that you can join. There's a pop up and you can enter your email in there. I'm on Instagram, I'm on Facebook. So those are probably the areas that you could connect with me the fastest.
yeah.
But yeah, that's pretty much all the places that I am right
Well,
now.
like we all kind of have to like spread, divide and conquer a little bit, but just that way
Yeah.
we can be easily accessible for folks. And you said you have like you have an office. We're here in Fairfax City in Northern Virginia, but do you do any kind of like virtual? Um,
Yeah. So my office is in Old Town Fairfax, and I love it when my patients will come in at least for that first appointment, just so that we can do all that testing, that fun testing that's included. But of course, if they're unable to, that's okay. We can do virtual telehealth appointments. I'm also licensed in Pennsylvania, Maryland, and DC. And so the options are endless as far as
yeah.
what we can do.
That's awesome. And I like how like you're very upfront with saying like your packages too and that length of time, because it really does take time to
Yes.
develop like a new like habit, or to really make a noticeable change. Like, yeah, our body, it's not, our evolution has not caught up to our lifestyles of just the instant gratification right now. So
Right.
I'm often always like setting that time expectation with body healing for like the physical therapy side of things,
Yep.
of how long it really takes for true muscle strength to happen,
Hmm.
versus like, oh, I'm feeling better, because you're making that neural, motor connection. But the actual muscle belly itself strengthens. It takes like, it could be 6 to 8 weeks, could be 10 to 12. So it could take a few months to really get that true muscle strength there.
Yes.
But with the gut stuff, it's like, yeah, like it takes a little bit to like, you might be really good for like this week, but like life may happen,
Hmm.
and like to like
Yep.
keep going. Or I'm sure with like elimination diets,
Hmm.
right? So maybe like speak a little bit about that. Like, what does that really mean? Because that's like, we're getting all these like kind of like nutritional fad stuff,
Yes.
So like people are like,
Yes.
oh, functional medicine, elimination diets, and all that. So like, what does that mean?
Yeah, no, that's a great question. And I would actually start by telling you it's not a diet that I will recommend very often, actually, because it's so restrictive. And I have found that it actually creates more problems a lot of the time than it
Yeah,
helps.
yeah.
I think that, yes, I've tried smaller packages, but you're right, these things take time. And I always like to make that reference. It's almost like we're building a house together. So
Yeah.
I'm going to give you all the tools and all the equipment, but like you have to go out and do the work. I
Right.
would love to come to your kitchen and cook for you, but that's not my role here, right?
Right.
So they really have to set that strong, solid foundation. And I would say the shortest amount of time that takes is 3 months,
Yeah.
but
Yeah.
sometimes people need more, or we're running more testing to address different systems within the body. So we need more time. The other thing is, a lot of times with the gut testing, the stool testing, my protocols could last anywhere from 8 to 12 weeks. So we might need to put you on certain supplements for that amount of time to correct whatever it is that we found in the gut. And then by then, most people don't have to retest, they just feel better. So it's more of
Mhm.
like we move to a maintenance phase
Yeah.
once we're done with that.
Yeah. Yeah, we
So,
have to be realistic about how our body works. Everybody wants to just kind of like do a quick fix or something like that's like,
yeah.
the body's not convenient.
Right.
It's
Right.
like
Right.
it's
So you
your
were,
work.
yes, and you were asking about the elimination diet, and
Yeah.
I feel like some of these things that are recommended maybe by our doctors is just because yes, there's research out there and it's almost like a blanket statement like, well, we know that gluten and dairy could be inflammatory, so why don't you try to cut those things out? When in reality, what you should do is try to find someone like me, whether it's me or someone with similar credentials.
Mhm.
Find somebody that has studied it for 4 to 6 years, right? That
Right.
has the license and the understanding of nutritional biochemistry and how that food impacts the different systems of the body. But I think to just put somebody on an elimination diet, we usually don't need to do that because we can tweak other things and still kind of get to the bottom of whatever it is that we're trying to address.
Yeah, because and for those that don't like kind of really know, yeah, it's like they whittle you down to like nothing.
It's
I
almost
mean, it's
like when
like,
you're sick and you can only have like those bland tasting foods,
yeah.
right? Like it's very, very limited.
Yes, and then that's slow, and then it's like introducing one kind of food group over like a long period of time, and then
Yes.
another food. So it's like it's gonna take that amount of time, too. So
Yeah.
it's like if we're gonna do that same amount of time, I'd rather be a little more honed in individually, not just like a blanket slate.
Mhm.
Um,
Yeah,
so
or I find that people will follow it and then never really feel comfortable or safe enough to come off of it.
yeah,
And then we see really big gaps in the diet where nutritionally you're not getting the right fuel that your body needs to thrive, really.
yeah, yeah. and
Yeah.
and it's shown in other areas, yeah, and our sleep and
Yes.
our energy, and like I'm trying to get people to be like nice and strong, because we're in the perimenopausal space, for
Yep.
example. It's like resistance training is huge,
Yes.
but you're exactly right, like earlier, that like women tend to not feel enough,
Mhm.
um and we need to be strong, you know? So it's like, how am I supposed to get some strength gains if we're not fueling our body
Yes.
for that appropriately?
Yes.
So it's very much like both, right? All of our worlds like collide, but it's so nice, and that's like the biggest thing, and like underlying theme of this whole like series of podcasts that I'm doing is to just show people that your body doesn't work in silos. It
Mm-hmm.
is very comprehensive. You
Mm-hmm.
might need, yeah, multiple providers at the quote unquote same time, but you're not seeing like everybody in one day, you know?
Right.
So it's
Right.
like
Yeah.
it can be over time.
Yes.
You don't necessarily need to stop one person to see another. It's like no, actually, when we are still an active client with the same people, it's really beneficial. So that when we have a chance as providers to communicate any kind of changes or any kind of feedback that you give, so it's like we can get on that right away and not be let's just work on like strengthening. Okay, we kind of hit a plateau. Well, it's probably maybe because you weren't fueling yourself, and we probably could
Yes.
have gone a little further,
Yes.
um, or like vice versa. You know, like you're like, okay, your diet's doing great, but you haven't really challenged yourself to really see.
Yes.
And that's what we need. But I love how functional medicine is becoming more and more like a home name, you know,
Uh-huh.
because I think it's so neat, and it is complementary to, yes, like the more traditional medicine stuff, but for somebody to take the time like yourself to dive deep into more comprehensive testing and have that time with you, that's what everybody wants and needs.
Mhm.
You know,
Yes, I agree. Yes.
that individualized care is like what everybody kind of gripes about, you know, but yes, the insurance model is not the best model, and I think people are getting fed up with it right now. And they're seeing that a lot of providers have been going away from that. And but
Right.
this is the kind of care that we can deliver when we're not limited, and we
Yes.
can go into that, you know, in-depth, comprehensive testing and individualized plan, and really follow up with you over time, and not be limited by visit counts or any of that bogus crap.
Right. Yeah, I know. And that's one of the other things that I include in all of my packages is unlimited access to me. I don't know if you do the same thing with your patients, but if something comes up and they need me, I want to be available for them.
Yeah.
I know that they've invested a lot in this service, and so I want them to feel like they're getting everything out of it.
100%. Yeah. Yeah. Absolutely. It's like, we want to like set up what kind of have like phases of treatment. For myself, the last phase is
Yep.
a little bit like an on your own independent phase, but like
Yeah.
I'm still here. You know what I
Right.
mean? So I can never like discharge anybody. It's more like
Yes.
ta ta for now, and let's check in with each other in like 6 or 9 months, kind
Yeah.
of thing. Or if something, I'm like, we're here, right? It's like, don't
Right.
wait until that point if something's popping
Yes.
up. But yeah, and I think it's just so good to kind of again to hear that it isn't just like diet and just nutrition. Like you're looking at the full scope of things, going like over time, and we can definitely collaborate with each other. It's more than just getting like some online recipe and seeing how it
Yes.
goes, kind of thing.
Yep.
That's so great. Well, thank you so much, Lena. So again, what is your website, and what's your like social media handles and that kind of stuff so people can find you?
Yeah, so my website is www.landisnutritionfm.com. And I'm on Instagram at Lena Landis 365 or at Landis Nutrition FM. And then Facebook, I don't know. I guess you just put my name in and
Right away.
maybe something will pop up. I'm not quite as active on Facebook as I am Instagram,
That's
but
all good. All good. Well, thank you so much, Lena, for joining me today. And yeah, for everybody, like seriously, look up Lena Landis, because this is so neat. I love functional medicine folks. I love collaborating with them. You just have a wealth of knowledge, stuff that's outside of my scope. I'm like, oh God, I'm like, I don't know. I'm like, I would be doing the client a disservice if I just like Google, anti-inflammatory diets. Like, no,
yeah,
it's much more than that.
yeah.
So yes, look up Landis Nutrition and Functional Medicine. And thank you again, Lena, so much for joining.
Yes, thank you
And
so much for having me. This was so much fun. Maybe there will be a part two.
I know, right? Awesome. And so for everybody else, we'll see each other next time. thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirley North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.